doing the filler today on Verona. For her, she wants a full face correction. And so we'll do some analysis and we'll do the fillers. There's no question that for you, it is the eye bag that shows the most. But obviously, the solution for the eye bag is surgery. But one of the main reasons why your eye bag shows even more is that your mid-face region really is hollow. And because that area is hollow, everything else shows. Volumizing the mid-face region will really kind of balance out your face and make your face look more distinctive. So if I look at your overall shape of your face, it's obviously pretty good. Right above the eyebrow, it is a little bit flat. And so what we can do is add some volumization, not your entire forehead, but kind of like just above the eyebrow bone, and then also a little bit on your temple. And then flat mid-face and prominent maxillary bone. And so it makes that transition point from your mid-face to your upper lip more deeper. And so by adding volume there really will help not just get rid of your smile line, or at least minimize it, but also make your maxillary bone less prominent looking. And I think that's actually the key. And then certainly, I think your chin can use just a little bit more of an accentuation. The key thing always is never do too much to change who you are, okay? But just kind of give you more of an enhancement. Okay? All right.
After the injection, I'm not so swollen. It's much better than what I thought before. And then it took me like around a week for the major swelling goes down. And right now it's 2 weeks out. For feeling wise, I didn't feel any injectable on my face right now, but I do look so much refreshed. And everybody sees me right now, including my family and my friends, saying like, oh, Verona, you look like you're awake. Like you're not so tired. So I'm super happy with the result.